Hi class, welcome again to another session on biomaterials. So we are discussing our fourth unit and today we shall discuss maxillofacial implants. So maxillofacial implants are used for face bone or skull augmentation or reconstruction. So it is all about meddling with your face bone or your skull. So there are two types of maxillofacial implants. One is extraoral and the other one is intraoral. So, intraoral implants are defined as the art and science of anatomical, functional, or cosmetic reconstruction by means of artificial substitutes of those regions in the mandible, maxilla, and the face that are missing due to surgical intervention or trauma. So, anything that is dealing with your mandible, maxilla, and face, which is any part that is missing from your mandible, maxilla, or face due to either surgical intervention or trauma, is the implant that is used to replace this loss is called as intraoral implant. For extraoral maxillofacial implants, polymers such as PMMA, polyurethane rubbers, silicone, and polyvinyl chloride acetate 5 to 20% copolymers are used. So there are certain prerequisites for a material to be qualify as an extracorporeal implant, and these are that the color and texture should match that of the patient and should be chemically and mechanically stable, and it should be easy to fabricate. It is like pretty straightforward demands, right? You don't want the implant to look really awkward on your patient, right? At the same time, you want the implant to serve its purpose. Therefore, it should match the color and texture of the patient. It should be chemically and mechanically stable, and it should be easy to fabricate. You want the material to be readily available, right? You don't want the patient to wait for ages before the material is finally fabricated. So the prerequisites for an intraoral implant is same as that of any implantable biomaterial because it's going inside the body, right? So whatever uh, prerequisites are there for an implantable biomaterial, the one that we discussed in the first unit, should be satisfied here as well. So the materials for correcting maxillary, mandibular or facial bone defects are metals such as tantalum and or vitellium. Right, vitellium is I think a cobalt chromium alloy. So for soft tissue replacements such as the gums and the chin, PMMA or silicone rubber are widely used. So injectable silicone, which polymerize in situ, has also been used to correct facial deformity with partial success. Although this method involves minimum incision and surgery time, it has not been widely accepted because it causes tissue reactions. It invokes tissue reactions, and displacement of implants have also been one of the complaints regarding injectable silicone. Therefore, these are not very popular. So maxillofacial implants can be classified into three types or three different types of surgeries, to be honest. First one is face contour correction. Mandibular reconstruction is the second one. The third one is the temporomandibular joint reconstruction. So just as a revision, temporomandibular joint is the joint at your lower jaw, right? The joint that connects your lower jaw to the temporal section, temporal bone of your skull is the temporomandibular joint. So reconstruction of that joint is also a part of maxillofacial augmentation. So facial contour corrections, you have a wide range of materials that are used. The first one is silicone rubber, either in the fluid form, gel form or in the solid form. So areas of application are chin, the zygomatic process, nasal cavity, maxillar, mandibular and orbital corrections can also be performed using this silicone rubber. So advantage is that for 20 plus years this has been used successfully. It can be trimmed to match the anatomical contour of the human, and it can be combined with other porous material to facilitate tissue ingrowth. However, the disadvantage is that bone reabsorption with and without the loss of soft tissue is seen with these kind of implant, and it is difficult to carve. It is difficult in carving if there is a host defect. If there is a host defect, then to match the dimensions closely using silicone rubber is very very difficult. Next material that has been used widely is Teflon, either solid or woven with tissue tolerance nearly equal to that of silicone. So this has been used as orbital floor sheeting. So orbit is the part of the skull where the eye is fitted in. So for that, for orbital floor sheet replacement, Teflon has widely been used. It has a very high success rate for this particular surgery. However, the tissue adherence for this material is very very poor. Then you have PMMA, which used to be used for the face contour surgeries. However, they induce chronic tissue reactions and the from monomer release, and there is bone reabsorption that has also been visualized. Therefore, PMMA is no longer used for this kind of applications. You also have the PET, which is used for or polyethylene terephthalate, which is used for facial and mandibular discontinuity defects. However, this is very very limited use, and therefore it's not much to discuss on it. Finally, you have the ProPlast, which is suitable for all facial applications. It facilitates tissue ingrowth. It can be carved into various anatomical shapes. However, the main disadvantage is that antibiotic infusion is very very essential in order to avoid implant contamination. I think that's all I have to speak on facial contour reconstruction. I hope you had a fruitful session learning about these with me. I shall see you again in another video, and I hope you take care till then.